Good afternoon. As on today, total positive cases in the state stands at 112. And the number of active cases are 104. All positive persons are receiving medical care at a designated COVID-19 hospitals. Active surveillance is going on to prevent further spreading of the infection. As per the severity of symptoms, there are 103 asymptomatic cases, 1 mild symptomatic case, and as stated yesterday also, 8 have recovered after treatment from COVID hospital in Mmhonlumo. Out of the 112 positive cases, there are 81 male and 31 female. Further, 4 are in the age group of 0 to 17 years and 108 are in the age group of 18 to 44 years. But this detail I can give you. The cabinet meeting was held yesterday and briefing was given by the Health and Family Welfare Department on the latest status of COVID-19 pandemic in the state. The cabinet deliberated on the existing SOP for the returnees and considering the need for further strengthening it, decided inter alia to also provide for allowing paid quarantine to those returnees who wish to avail of it, encouraging and enlisting private labs to conduct tests for COVID-19 at the government-approved rates, designating police quarantine for inmates indulging in unruly or delinquent behavior, and enlisting cooperation and involvement of the tribal bodies and government officers, associations for providing food, etc. in the institutional quarantine. The cabinet also decided for getting the details of quarantine returning workers, such as name, address, village, mobile phone number, past work experience, or the trade engaged in, particular skill proficiency, etc., for developing institutional mechanisms for skill up, upgradation, and training, so that people who stay back are able to get gainfully employed and earn their living. It was also decided that mechanism will be put in place for registering anyone who wishes to go out of the state for work, so that all the details are available and government is in a position to promptly reach out to anyone outside the state who is in distress and provide assistance should any such need arise in future. The cabinet also asks the DGP to identify persons circulating fake or deceitful videos and messages pertaining to COVID-19 in the social media and punish them as per the law. Regarding the ongoing exercise of bringing in the returnees to the state, a bus carrying 29 passengers from Jammu and Kashmir is reaching Nagaland today. Tomorrow, 34 passengers from Madhya Pradesh are reaching by bus, and a special train from Maharashtra and Gujarat carrying 938 persons will reach Dimapur. After the high power committee was formed, as you know, we had a meeting with the district task force Kohima. We have come to know their problems also, and we have come closer. And even Dimapur task force also, we had a meeting with them. And we have understand their problem. Yes, about one returnee's parent that was, you see, that was done when people, there was a mistake, but the hospital authorities, they also admit that they had a sleepless night sometimes, but then the name was also a little bit similar. So that is why I think everybody should understand that it was not the intention, but sometimes those who does, they make a mistake. So as of now, from here I'll pass on to my friend Kronu.
Once again, very good afternoon to all of you. I want to thank all of you for coming. This is the second press conference that we are having after I was made a spokesperson. One of the features you would have noticed, which we mentioned last time, is that all the committees and in charges which are manning the war room are present in this press conference from both the medical department and home department, and officers who are in charge of various responsibilities in the war room are here. So it's an integrated sort of a press conference that we want to have every once in a while. Let me begin by just giving you an information. Last time, I think it was already in practice. Some of our journalists have already told us that they always go to the website to get all the infos, both on the SOPs and the details available and live updates. But for those of you who don't have that website, I want to just give you just www.covid19.nagaland.gov.in. If you go inside, you will get all the information and live updates. And I will be giving out, forwarding this link to some of you, so you can kindly share it in your common WhatsApp group, so that for quick updates you will be able to avail it. There are other websites if you want to. I just want to suggest that the Ministry of Health and Family Welfare and also the ICMR websites if you want to go for an all India perspective. I want to also, one of the concerns that citizens of Nagaland have is about plans that the government of Nagaland has on the economic affairs and also on various strategies for strengthening our economy vis-a-vis the pandemic lockdown and the challenges that have arisen out of this. So I want to let you know, for those who are not already aware, that there is already a strategic committee on economic affairs headed by the Honorable Chief Minister. There is also a core group headed by Additional Chief Secretary and Development Commissioner who would submit strategies after consultation and proper homework for strengthening of economy vis-a-vis the pandemic lockdown economic challenges. So these are the two committees which exist and which have been having several rounds of discussion and assessment of the situation in Nagaland. From the very beginning, before the lockdown started and even after that, the government has been taking the challenge of supporting students from Nagaland, outside of Nagaland state, and those people who are working outside of Nagaland state who are citizens of Nagaland, to look into the issues that they have raised. Because the lockdown which was announced made most of them, one, colleges were closed, offices were closed, and issues were raised. So right from the beginning, Government of Nagaland has been supporting them. The plan was chalked out, and in comparison to our neighboring states, or even in the whole of India, Government of Nagaland has spent the most number of money in supporting our students and working persons outside. Just wanted to share with you the total number of amount of money we have spent on and on what heads. Number one, initially, the CM announced a special package for students at the rate of 3,000. Also, at the same time, special package for working persons at the rate of 4,000 was announced. And we have a total, we have a breakup which is available in the website. So if you would go to the website, which I will share with you if you don't have, then you will find the breakup. One of the most important aspect of this is that CM had also announced a special package for patients who are outside of Nagaland state at the rate of 20,000 per patient. So this was an assistance given, and a one-time assistance for non-returnees as well. And was of rupees 10,000 was given. So out of several applications that the government received, some of the applications were rejected for various reasons. However, I was informed that War Room had attempted to ensure that even though people may not have bank accounts, they have communicated with genuine candidates as ascertained by the War Room based on the modalities which were given to them. A total amount of 24 crores, 84 lakhs and 86,000 has been dispersed till date. I will repeat, 24 crores, 84,000, 84 lakhs, 86,000 have been dispersed till date. The concern and the action of the government of Nagaland to help and support our students stranded outside through the website I Am Stranded has been shown by this support that the government has given. Further, the government will publish the list of all the beneficiaries and the amount given to them in the next few days. And that list will also be available in the website. However, we will have a press conference again in the days to come. The other announcement I want to make is there has been a lot of concern about the capacity of the state for the intake capacity of the state in the quarantine centers. So you would have already got most of the details, but I will just like to read out the figure. And I'll not go district-wise quarantine facility status, but the entire state total quarantine facility that we have as of today is 238 quarantine centers. The total number of beds available is 13,008 number of beds available, and this is as on 7 June 2020. It will be available on the website as well. So, in terms of the number of people who are coming and the number of people who have already completed their 14 days mandatory quarantine period, there will be an adjustment, and there will be some going out, some coming. So that there is no confusion. There were some doubts which were coming, which were being asked to the government through various administrative heads whether we have enough capacity. So the capacity is not that if 12,000 come, they will be housed at one go. So they are coming in batches. So our learning experience in the past 2 months has enabled us to address the various management issues, and our district administrators are also working 24/7 to address these issues. The other, before I ask some of our officers to respond to one or two information that we've not given out, I would like to just tell you about the quarantine protocols in different states. In the entire country, Nagaland ranks on the top 5 in terms of as the strictest quarantine protocols being imposed on our returnees, and this is because we were ramping up our facilities, our testing capacities in the lockdown period. As you all know, another information I want to give you is that 7 TrueNet machines have come, and they've been, I think media has already highlighted the distribution of the TrueNet in various districts. 15 more are coming in a few days' time. So once in a week's time, all the TrueNet machines are installed, along with the BSL lab that we already have, and already it's being used for testing. The testing capacity per day as of 4 days ago was 171 per day. And according to the medical department, once all these TrueNet machines are installed, in another 5 or 7 days, the testing capacity of the state will increase from 171 to 800 testing capacities per day, 820, sorry. And that will greatly ease the state's capacity to ensure that all the district COVID hospitals will be able to test the returnees, and later on anyone who is willing to get themselves tested in their own district. So that is one of the positive news. As our minister has already stated, 8 has been retested negative, which means to say they have they've been, I mean, I'll leave that to the doctor, but already today in the media we have seen that quarantine facility rules and regulations have been published. This, as our minister has said, is to respond to the various challenges we have had. One of the clarification that I would like to make is that a lot of people are asking us about the SOPs. See, the main framework and the policy structure remains the same. There are certain changes or certain SOP reviews which are done to respond to current and unforeseen challenges. So it does not mean that we have changed the entire SOP. SOP review is done in every occasion, every situation. SOPs are meant to respond to challenges, and it cannot be static. It's a dynamic document.